According to AVERT, East and Southern Africa is the region hardest hit by HIV. It is home to 6.2% of the world's population, but over half of the total number of people living with HIV in the world, approximately 19.4 million people. In 2016, there were 790,000 new HIV infections. Before going further, we need to know what exactly is HIV and what are some symptoms HIV patients had.
HIV is the human immunodeficiency virus. If you have HIV, you have an infection that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the final stage of an HIV infection when your immune system is damaged and too weak to fight off ordinary infections.
How is HIV transmitted? HIV is present in the blood, breast milk, and the semen, vaginal fluids of infected people. The virus can only be passed on to another person if these fluids get into his or her body. The ways HIV can be transmitted: sex without a condom, sharing infected needles, syringes, or other injecting drug equipment, from an HIV-positive mother to her baby during pregnancy, birth, or breastfeeding.
Mrs. Angela lost her husband to HIV a few years ago, and now she's living with the virus, which left her with stigma. And here is her story.
Mimi ni widow, kona watoto watatu, wasichana, mjukuu mmoja, na mimi niko na miaka 43. Niliamua kwenda VCT, mzee alikuwa anagonjeka sana. Vile tulipimwa tukapatikana positive. Sasa tukaangaliana hivi, hakuna mmoja anaongea na mwingine, kwa sababu hakuna yule alikuwa anaamini Kenya tumeambiwa mtu yoyote, kwa sababu hapo mahali tulikuwa tunaishi hakukuwa na jirani, mtu wetu wa jamii, na tena majirani huwezi ukaeleza. Ukieleza jirani sasa mambo sasa kutengwa ni hivyo, hatungeweza.
The medical personnel, they are judgmental. Most of them are judgmental towards us. Like, for example, if I go to the hospital and say I need to get condoms, what are they for? I mean, you're not married, so what do you need condoms for? Or if I say I want to get tested for an STI, why have you been having sex? They'll judge your behavior instead of giving you the help that you need.
I started having sex when I was 15, though I didn't have enough information on sex, on contraceptives, on how to prevent unwanted pregnancies. I would wish that back then, before I got pregnant, I wish I had someone to tell me a lot about sexual reproductive health. The time that mom gave birth, because I was still breastfeeding as well. She gave birth, then after 3 months, then she died. So I was the one taking care of my baby brother, breastfeeding my daughter and my baby brother. So life became more tougher than that.
If we don't take this moment to reach out and teach about adolescent girls, HIV and AIDS and sex, we're killing the future generation. We're going to shut the mouths of great leaders who will not have the chance to finish their education because they were not listened to.
Number of reasons to why they are getting pregnant with HIV and AIDS. It's out of desperation due to poverty in the country and in the communities, which leads them to, wanting things from other men.
Mhokolema. Tuhu tutenaria shala, tulibawi kasha tuhu. Kulinta kutoja tu pante ke ngompe.
Kienyeji shise ka jina samani.
Julia kama
Wa kienyeji shise jina samani ngompe tena hange sifa.
Kenandama. Kamsini. Ijo jeni fries. Nakaona ke ngwana ne twage tekhana ne kuthumo nage ni thela. Kasawi jamisa kasukuma tuli cheno ro khula. Nakazunire jatumo moka phangile ngwana na some. Iri bande agoni saidila hawo thongi. Aga rusikana na ke jalo go dewa go sabahu. Uneno khono na thumamu ni monu mala. Lakini aja ka thoke ga no na ke khai ni tu manamo ne ngombe na ngwaga veje kha kono ko ka thoja ki agwigala go juni fukulu no na mala no malinguzu.
The communities haven't been given as much credit as they deserve collectively, because the communities have actually been the primary providers of care and support to children who are classified as vulnerable. They provide about 90% of total care. But then again, most of the care that a community provides is sporadic. The only systemic care that is provided, which is like very systematic and intentional, comes from international actors. Why is it that the systems of care have withdrawn and left the care of children to external actors? And another thing that is troubling is, we've seen cases where children, we've actually touched on this in the book, children are left to raise themselves, and communities have okayed that, and even UNICEF and UNESCO have also okayed that. We have the concept of child-headed households. And this is, communities are proud in saying we have child-headed households at the corner of the street.
Our parents died of HIV. We are 4, and me, I'm by the name of Ola Ambrose. As me, the elder boy, I should plan for the family. I must struggle in order to get education so that I can, in future, if I get jobs, I can provide them everything.
One out of every 5 people living with HIV in the world lives right here in South Africa. We estimate that there are about 1,000 new HIV infections in South Africa each day.
Every single day?
Every single day. And what's critical in that, it's not just that there's all this HIV, but that young women are a key factor in the highest incidence population.
All of these children are orphans infected with the HIV virus whose parents died because of AIDS. Today, there are approximately 1 million orphans in this situation in South Africa. Every year, 80,000 newborn babies are added to this sinister list. And if the progression continues, in the year 2000, there will be between 2 and 3 million newborn babies with AIDS. At Sparrow Rainbow Village, a week without a burial is quite uncommon.
The story about this baby is that his mother is 19 years old. She came from the Transkei, which is quite far down in the Cape, and she came up to Johannesburg to try and find a job. Like any young girl of that age, she obviously got sexually involved and got AIDS, not realizing it was less than 2 years ago. She's very ill, and she left the babies with the twins, with the neighbor who was here, And then she just couldn't cope, and she said she'd come back, she'd get money, but obviously she's not earning anything, and she may be living with somebody. We're not here to judge.
The previous parliamentary session added another amendment in the Education Act. For example, if a man is caught guilty of marrying a child below 18 years, he will be jailed for 30 years. Again, if a parent allows his or her daughter to get married, again, he will be charged the same as the one who marries the girl for 30 years.
One of the real watershed turning point years was 1996, when we developed the triple combination, which started off with the protease inhibitor. We were able to turn HIV from a completely uniformly fatal disease to one in which people can live a normal life.
About 3.4 million HIV-positive South Africans take these life-saving drugs every day. Antiretrovirals suppress the AIDS virus and help the body maintain a healthy level of white blood cells. Previously, the health department only offered ARVs to patients whose immune systems had weakened to a certain level defined by a CD4 count. But from the beginning of September, all HIV/AIDS patients will be eligible to receive the drugs.
When the disease threatens to triple child mortality and to reduce life expectancy by 20 years in some African countries, it is time to say that AIDS is also a moral crisis.
And to meet a severe and urgent crisis abroad, tonight I propose the emergency plan for AIDS relief, a work of mercy beyond all current international efforts to help the people of Africa.
The fight against this disease has united us across parties and across presidents, and it shows that we can do big things when Republicans and Democrats put their common humanity before politics. So we need to carry that spirit forward.
If you leave one person behind, you've left all of us behind. Because all of us are human, all of us are part of that global family. We're all in this together. That means all of us, independent of race, gender, sexual orientation. Either we all move forward together or none of us achieve what we wanted.
Shiambonga, 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 Shimbamundi, Shiambonga, 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 Shimbamundi, Shiambonga, Chilalumba, 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 Basilindi, Chilalumba, 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 Basilindi, Chilalumba.